this is probably the most interesting and adaptive thing that we've been able to do in the midst of all this. So we've migrated largely to a telehealth platform, but of course, as a surgical subspecialty, and frankly, probably in most independent practices, there are certainly patients who just have to be seen in the office. So, our incorporation of these mechanisms has been dependent sort of as we've gone along the process and as information's come out about the disease. But at this point, aligned with sort of the recommendations of social distancing, we have limited providers in the office. People are, in fact, 6 foot buffered both in the office, and if there were to be more than two patients in the waiting room, there was already separation of chairs. That was several weeks ago, prior to the state mandate about limiting social interaction. So we had already adopted that. So again, we've got those space buffers. We created sort of a coronavirus czar to manage our medical policies within our office, to establish a clear and consistent safety protocol that bridges different offices and different locations. So there was no question about different people having authority. There was one person who had authority, and there was no question about different locations establishing their own protocols. We instituted, as I said, our earliest policies about 4.5 weeks ago, and then again have made those significantly more robust over time. So I expect that many of these are fairly common in practices now, but I'll just mention a few. Robust phone call screening for travel history and symptoms, declining patients who express symptoms or referring them, frankly, to a more appropriate setting to be tested. Patients are re-screened at the front desk with those same questions. We have universal masking in our office, both for providers and for patients. We've been checking temperatures for all employees and all patients, again, for about that same interval of time. Limiting the number of people who are able to accompany a patient into the office, essentially one adult, and in general asking that they not come back to the exam room unless absolutely necessary for interpretation of information or they really do require a chaperone. We have very clear self-quarantine protocols for our staff and have asked our staff to really, there's a no judgment policy. So if people have any questions about a family member or a personal exposure, they are really encouraged to come to us right away, and we're able to answer those questions, again, with the best medical information that we have available at the time. And then finally, we have identified vulnerable staff who have either voluntarily removed themselves from clinic or have been redeployed to non-clinical roles. Again, that's been sort of based on our assessment that based on the best medical information, which is not always perfect, that certain people really should not be out and about in the midst of all of this.